Imagine a disease that slowly steals away your memories, making it difficult to remember familiar faces or even how to do everyday tasks. This is the reality for millions of people living with Alzheimer's disease, a brain disorder that gradually destroys brain cells, affecting memory, thinking, and behavior. Alzheimer's disease was first discovered over a century ago by Dr. Alois Alzheimer. He noticed unusual changes in the brain of a woman who had passed away after experiencing memory loss and other cognitive difficulties. Today, Alzheimer's is the most common cause of dementia, a general term for memory loss and other cognitive abilities serious enough to interfere with daily life. While there is currently no cure for Alzheimer's, understanding the disease, its causes, and progression can empower individuals and families to seek early diagnosis, access available treatments, and provide the best possible care. This journey begins by delving deeper into the intricacies of this complex disease. To understand Alzheimer's, we must first journey inside the amazing human brain. Our brains are intricate networks of billions of neurons communicating through signals. In Alzheimer's, this communication network breaks down. Amyloid plaques and tau tangles disrupt neuron function. This damage initially affects memory areas, leading to memory loss. The exact causes of Alzheimer's disease are still not fully understood, which can be frustrating for patients and their families. However, scientists have identified several factors that contribute to the development of this complex disease, with age being the most significant risk factor. As we age, our brains naturally undergo changes, and some individuals may be more susceptible to developing Alzheimer's due to a combination of genetic and lifestyle factors. Genes play a role, as family history of Alzheimer's increases the risk. Furthermore, lifestyle factors such as diet, exercise, and social engagement also seem to play a part, although more research is needed to understand the intricate interplay between these factors. Despite the unknowns, ongoing research continues to shed light on the complexities of Alzheimer's, bringing us closer to effective treatments and, ultimately, a cure. Alzheimer's disease is a progressive illness, meaning it worsens gradually over time. It's helpful to think of its progression in stages, although it's important to remember that every individual experiences the disease differently. In the early or mild stage, a person might experience subtle memory lapses, difficulty finding words, or misplacing objects more frequently. As the disease progresses to the moderate stage, these challenges become more pronounced, and individuals may require assistance with daily tasks such as dressing or bathing. In the later or severe stage, individuals with Alzheimer's may have difficulty recognizing loved ones, communicating their needs, and require around-the-clock care. Understanding these stages can help families and caregivers anticipate the challenges ahead and provide appropriate support. Section 5. Early Signs. Recognizing the subtle clues. Early detection of Alzheimer's disease is crucial for several reasons. It allows for earlier intervention with medications that may help slow the progression of symptoms and provides more time for individuals and families to plan for the future. While some memory problems are a normal part of aging, Alzheimer's-related memory changes are more persistent and interfere with daily life. Forgetting recently learned information, important dates, or familiar names and needing to ask for the same information repeatedly are red flags. Other early signs include difficulty completing familiar tasks, such as following a recipe or balancing a checkbook, as well as changes in mood, behavior, and personality. If you or a loved one experience any of these symptoms, it's essential to consult a doctor for a proper diagnosis and to discuss available options. Section 6. Navigating treatment and care. While there is currently no cure for Alzheimer's disease, there are treatments available that can help manage symptoms, slow down the progression of the disease, and improve quality of life for both the individual and their caregivers. Medications can be prescribed to address cognitive symptoms, such as memory loss and confusion, while other therapies focus on managing behavioral and psychological symptoms like agitation, anxiety, and depression. Non-drug approaches such as art therapy, music therapy, and reminiscence therapy can also be beneficial in engaging individuals with Alzheimer's, stimulating their minds and fostering a sense of connection. The journey of navigating treatment and care can be overwhelming, but remember that knowledge is power. By staying informed about the available options and working closely with healthcare professionals, individuals and families can make the most of the resources available and create a supportive environment for their loved one. Section 7. Caring for a loved one with Alzheimer's tips for families. Caring for a loved one with Alzheimer's disease can be both challenging and rewarding. It requires patience, understanding, and a willingness to adapt to the ever-changing needs of the individual. One of the most important things you can do is create a safe and supportive environment for your loved one. This includes removing potential hazards in the home, establishing a regular routine, and providing clear and simple instructions. Communication is key, and it's important to remember that even in the later stages of the disease, individuals with Alzheimer's can still sense and respond to emotions. Speaking calmly and reassuringly, using simple words and sentences, and engaging in activities they enjoy can help maintain a sense of connection and well-being. Section 8. What not to do. Avoiding common caregiving pitfalls. While caring for someone with Alzheimer's can be deeply fulfilling, it's also important to be aware of common caregiving pitfalls to avoid. One of the most important is to avoid arguing with or correcting the person with Alzheimer's, as this can lead to frustration and agitation for both parties. Similarly, avoid asking them if they remember certain events or information, as this can make them feel embarrassed or ashamed. Instead, try to focus on the present moment, engage in conversations about their interests, and validate their feelings. Remember, caring for a loved one with Alzheimer's is a marathon, not a sprint. It's crucial to prioritize self-care, seek support from other family members, friends, or support groups, and celebrate the small victories along the way. Section 9. A shared journey, support, and hope for the future. Living with Alzheimer's affects individuals and their families. Remember, you are not alone. Support groups offer a safe space to share and find solace. Organizations provide valuable resources and advocacy. There is always hope. Research brings us closer to effective treatments. Face this challenge with courage and compassion.